Hi, and thank you for joining us today. My name is Dr. Todd Hoopman, and I'm Dr. Robert Scoggins, and we're here to talk about the mRNA COVID-19 vaccines. We decided to do this because there's been a lot of misinformation out there and a lot of people asking questions. It's been surprising to us the number of questions we've gotten from our own colleagues about mRNA vaccines in general and what mRNA is. So we put together a presentation and we're going to try to answer a few of these questions. But again, I'm Robert Scoggins. I'm the pulmonary and critical care doctor here at Kootenai Health. I'm also the medical director of our critical care here and chief of staff elect. I'm also a virologist from before I became a practicing physician. And my name is Dr. Todd Hoopman. I also am a board certified pulmonary doctor and a board certified critical care specialist. And I work at Kootenai Health in the Kootenai Clinic Lung and Asthma Center, as well as in the Kootenai Health Intensive Care Unit. A little bit about what we want to talk about today. We have really 4 items to our agenda. We'd like to first touch on what exactly is an mRNA vaccine. This is certainly something that's new to lots of people, and we'd like to explain that in more detail. We'd like to talk a few important facts about the COVID-19 mRNA vaccine to try and get some information that's a little clearer for everyone. And I think the third point is really important. We'd like to really touch on the safety and efficacy of both the mRNA vaccine that's being produced by Pfizer as well as the vaccine that's being produced by Moderna. And then finally, we're going to end with a series of commonly asked questions. And these are questions that have been posed to us by colleagues, employees, friends, family. We're hopeful that some of the answers will be helpful for you as you start to explore and understand more about COVID-19 vaccinations. So what is an mRNA vaccine? So messenger RNA is a unique set of instructions, kind of what the cell uses to produce proteins. And proteins make up or kind of what the workhorses of your cells. They do everything. There's enzymes that break down things, and they're the building blocks of your cells. So a messenger RNA utilizes the body's machinery to make these proteins. It's a naturally occurring process in all cells. And humans, animals, and viruses use this process to replicate. So the benefits of a messenger RNA for a COVID-19 vaccine is that the technology has been developing rapidly over the last 20, 30 years, and it allows for rapid development of a vaccine. You're able to produce messenger RNA synthetically very quickly and in large quantities is what you need for a vaccine. There's no eggs, latex, or mercury preservatives that are required. It's a very clean vaccine, and it's able to very precisely determine the vaccine target, which is the spike protein of the COVID-19 virus. So we get the question all the time is like, how did this happen so fast? And from my perspective is, why didn't it happen faster? As much as I know about DNA and RNA and our ability to make these things quickly, this is not a new process. We were doing this 20 years ago. The technology has progressed rapidly and over the last 30 years, and we're able to do a lot of things very quickly. So the COVID-19 pandemic really brought this technology to the forefront. It gave it the money to make these things. These companies such as Moderna, which were, well, they were making these vaccines for other reasons, but this gave them something to really go after and the urgency to really get the partnerships with other companies to produce these quickly. Well, there's a couple of facts that are important to understand about the COVID-19 mRNA vaccine. First of all, there is no live virus in the vaccine. What is in the vaccine, the most important ingredient is the mRNA. And mRNA is a very delicate molecule or very delicate substance. So in order for the vaccine to work, it has to be protected when you're given the injection. So it's protected in a very small microscopic
fat particle, basically. So it's got a shell around the outside, almost like an eggshell, that protects the mRNA inside. This nanoparticle is what allows the mRNA to safely enter into the muscle cells in the arm where you receive the vaccine. Interestingly, the mRNA itself is actually eliminated from your body in about 72 hours or less. So it's not something that lingers or persistently is present in your system. The mRNA itself, as Dr. Scoggins mentioned, is basically the recipe or the set of instructions that the body's machinery uses to make a protein. And in this case, it's making the surface spike protein of COVID-19. So in the picture on the upper right, that's a rendition of what the virus looks like in a cartoon format. And the spike protein are the red little spikes or the red little flower-like structures on the outside. The surface spike protein is very important because that's what's recognized by the immune system. That's how your body knows that you have a viral infection, or that's how your body knows that it needs to make antibodies to a vaccine. What's very important to understand is that mRNA does not enter into the nucleus. In your cell, DNA is present in the nucleus. There is no integration of the mRNA into your human DNA. The other part that's very important to know is that these vaccines very closely mimic a natural infection. And what I mean by that is when you are infected with COVID-19, the spike protein is produced by the virus and then recognized by your immune system. And so by producing the spike protein on a surface of a muscle cell after you get a vaccine, you're actually showing a very similar response to what would happen if you actually caught COVID-19. And that's what you want to do. You want your immunization and your vaccination to look very similar to an actual infection so your body can make the immune response that it's designed to do. In some cases, we actually believe that the vaccination is a better immune response than having the infection itself. And that's because viruses actually have processes built in that are designed to help the virus hide from the immune system, whereas the vaccine does not have any cloaking or hidden abilities. The other thing that's important to know is that this is a multi-layered immune response. So when you receive a vaccination such as the COVID-19 vaccination, you actually have a very immediate antibody production. So your body recognizes it as foreign. It makes antibodies quickly. Those antibodies are immediately circulating in your bloodstream. But, and perhaps more importantly, your body also makes what are called memory cells. And think of this like a library. The memory cells are then stored, and someday, if you later encounter the COVID-19 virus, your body can go to the library, open that book, and begin to produce antibodies very quickly and efficiently because of the memory cells that are already present in the immune system. So you get an immediate response, but you also, more importantly, get a future antibody response.
So a little bit about the vaccine side effects and safety, because this is what matters here, what a lot of people have questions about. You do expect your immune system to respond to the vaccine. And a normal immune response to a virus or a vaccine, in this case, would be to get a low-grade fever, a headache, muscle aches, injection site pain, redness or swelling, and fatigue. You may not get all of those. You may only get one of them, and they're usually transient. They don't last very long. The side effects are more common after that second dose, and that second dose is the dose that gives you that long-lasting immunity. The first dose primes your immune system, and the second dose really activates the immune system to give you the memory to respond to the virus in the future. And those symptoms, the fever, the headache, and the muscle aches, just really mean that the vaccine's working. It's not that you're infected with the virus, you haven't caught COVID. You can't get COVID from this vaccine. The side effects usually last less than 72 hours. I can tell you from personal experience on the first dose, I had a sore arm for less than 12 hours, and then it was fine. Allergic reactions are very rare. There were no severe allergic reactions reported in the Pfizer or Moderna study. There has been a small number of allergic reactions or some sort of reaction that have been seen now that we've given the vaccine to millions of people around the world. If you stick enough needles in people do have some odd reactions. That's something to be expected, and that's something that we see. But overall, of all the medicines and things that we give people in medicine, there has been very few significant reactions. At least 8 weeks of safety data were gathered in the trial. It's unusual for those side effects to appear more than 8 weeks after vaccination. And they're still doing safety monitoring of participants in both trials and of those who are vaccinated. I think that in terms of for a medicine standpoint, this is very safe and a lot safer than the long-term effects of COVID-19.
Well, briefly, I'd like to just touch on the two mRNA vaccines that are available in the studies that were utilized to obtain what's known as emergency use authorization. The Pfizer study examined about 18,000 patients in each one of the study groups. So about half the patients were vaccinated with the actual mRNA. The other half of the patients did not get the vaccine. They got placebo, a saltwater mixture. Similar study trial for the Moderna on the right-hand side. You can see it was a little bit smaller, but still in the order of 15,000 patients in each group. What's important to note is that the sheer number of patients who acquired or became infected with COVID-19 who received the placebo is significantly higher in both studies. You can see there were only 9 cases of COVID-19 in patients who were vaccinated, and only 11 cases in patients who were vaccinated with the Moderna vaccine. And that's compared to over 169 cases in the Pfizer study and 185 in the Moderna study. What that does is that translates into a 94 to 95% effective rate, meaning 95% of patients who received the vaccine in these trials were basically preserved or saved from getting the COVID-19 infection. There's a couple of interesting pieces that have come out of the Pfizer study because that's been more readily available for review. First and foremost is that partial immunity to COVID-19 began as early as 7 days after the first dose. The real progress for immunity probably starts closer to 10 to 12 days, but they started to see some improvement at 7 days. That doesn't mean that one dose is all you need. As Dr. Scoggins has mentioned, you really need that second dose to achieve the maximum immunity. We anticipate there'll probably be some similar 7 to 10 day improvement in the Moderna study when its final information is released. But as of right now, we have belief that the first dose actually begins to protect you somewhat, somewhere after the first week to 10 days, and definitely after the 21st day when you receive your second dose.
And I also say on this is that as we've seen here, there have been some people who've developed COVID after receiving the vaccine, and that's not surprising. That's what they saw in the study. It's that long-term immunity that occurs that is where you see the biggest benefit. It's usually not in the first 7 days, but after that is where you see it. The other thing is to note is that how similar the efficacy of these two vaccines are. There is really not a difference between a clinical outcome between Pfizer and Moderna. There's some small differences in how the trials were run and what they reported, but I would feel comfortable getting either the Pfizer or the Moderna vaccine.
But you also have to remember that if you get the Pfizer vaccine first, you need to get the Pfizer vaccine second. So you don't want to get one and then the other. You need to get both doses from the same vaccination. And that's part of the vaccination process. And when you get your vaccine, it will be made very clear that you're coming back for the second dose of the same manufacturers that you received the first time. So, go ahead.
Yeah, this is the fun part, the commonly asked questions. And when we did this originally for the employees, we had it live streamed to us, kind of like Twitter. So we felt very important. But these are a lot of the questions that we've received from people here at the hospital, family, friends. And so we'll try to answer them and may come up with some more questions as we go through this.
Well, first of all, and we've talked a little bit about this, but can you catch COVID-19 from the vaccine? And the answer is no. The external spike protein or the piece of the external spike protein that is produced cannot turn into an active virus. This is not like a tulip bulb that then grows into a virus or a tulip bulb that grows into a flower. It is an inactive piece of the virus that is recognized by your immune system to help produce the immunity that you need in the future. Other people have really wanted to know what happens if I get the vaccine and then I'm tested for COVID-19. Will I have a positive test? And again, the answer is no. The COVID-19 PCR testing, which is the nasal swab, that is performed. It's designed to detect a different part of the virus, not the external spike protein. So you should not have a positive PCR test after receiving vaccine. But what about if you got an antibody test? And so currently right now, there are two main types of antibody tests that are available. So can you have an antibody test that's positive from the blood after you get the vaccine? And the answer is perhaps. So if you got an antibody test to the spike protein, it likely will be positive because that's what your immune system is supposed to have produced. The other antibody tests are to different parts of the COVID-19 virus, and those will likely be negative because that's not what the vaccine is designed to produce.
This is a good question. If I have had COVID-19, do I still get the vaccine? And the answer is yes. We want you to first recover from COVID-19, but as you heard Dr. Hoopman talk about before, is that the virus has mechanisms to make to evade the immune system, and you may not develop as strong a response to the virus if it were to infect you just from the virus itself. The vaccine will just give you a stronger response and a longer lasting immunity. So it's believed that the vaccine will activate the immune system to generate memory cells, and these are CD4 T cells that are memory cells that will last for a long time. Let's see, does the vaccine hurt because it is kept so cold? No, we actually warm it up to room temperature. The injection site is due to the activation of the immune system and the production of protective antibodies. So you expect to get that. And the vaccine is not given to you at -20, it's given to you at room temperature.
Well, if you want to know a little bit more about what's actually in the vaccine, we pulled the information from the emergency use authorization from Pfizer and from Moderna. And you can see the first ingredient is the messenger RNA. That's the most important piece. Lipids, which is another name for fat, are the little protective particles that keep the mRNA safe when it's injected. And then there's a series of other, what I would describe as inert or non-active things that are included. And these are necessary to help make sure that the mRNA is safe when it's frozen and safe when it's thawed. So you see polyethylene glycol, potassium, sodium chloride, which is salt water, sodium phosphate, sucrose, which is a sugar. And then the Moderna vaccine has a teeny tiny small amount of acetic acid, which is vinegar. And that's mostly to keep the entire vial and the mRNA at the proper pH balance. And that's so that it's safe when it's brought back to room temperature. The other part that's really important to know is what's not in these vaccines. So there is no latex, there's no aluminum, there's no mercury, and then most importantly, there are no actual pieces of the COVID-19 virus.
Or any virus.
Or any virus. That's a good point. There's no other pieces of any virus in the vaccine. There are other vaccinations that are given that sometimes do have small pieces of a virus because it's just a small inactive piece, but this vaccination does not have that. This is made up of a very small amount of the elements listed above, and to the point of somewhere between 50 to 70 grains of baking powder if you were to kind of dry it out and put it on the counter. That's how small this is. It's added to salt water, or what's known as saline, which is then brought up to room temperature, and that's what's injected in your arm. So we feel that the ingredient list demonstrates that there aren't dangerous or concerning chemicals or other components that are in it that make us worried.
Oh, do I have to wear a mask after I get the vaccine? As you can probably see, we both have our masks on. So yes, the vaccine is not 100% protective. It's really good though, 95%. And so you still need to wear a mask. And the mask wearing is really to protect you from giving it to somebody else if you were to develop an infection. And most likely you wouldn't have very many symptoms. So most of the people who were infected in these trials had very mild cases of COVID. So you don't want to expose somebody who's not vaccinated. And I would say the way we get rid of the mask is that more people get vaccinated and we see the transmission in our community go down or hopefully go away. With a 95% effective vaccine, you can eliminate this virus from your community. Will I have to get the vaccine every year? Not really sure yet. We don't know what's going to happen to the virus as it goes through the population. We've already heard about some mutations. The mutations that this virus luckily doesn't make many mutations that are being spread through the community, through the population, but there could be the possibility that there is a mutation that would make the vaccine less effective. However, so far, all the data suggests that the vaccine, and the way this is done, makes it more likely that it will be effective for most mutations that this virus obtains. So we'll just have to wait and see.
There's been lots of questions about young women of childbearing age receiving the vaccine. And so specifically, people have asked, does the COVID-19 vaccine make young women sterile? There's no evidence of this in the vaccine trials. There's nothing that we're aware of that would put women at risk for sterilization from the vaccine. So our answer is no at this time.
Biologically, it's probably not possible for that to happen.
Right.
The way this vaccine works, it just doesn't work that way.
The second question that's come up is, should pregnant women get the vaccine? Now, this question was not directly addressed in the FDA emergency use authorization. Pregnant women were not included in the study population of the two trials. But that being said, we know that pregnant women are at a much increased risk of severe illness and unfortunately death from COVID-19. And those are for some pretty complicated reasons. But because of that, many of the national women's healthcare societies, specifically that focus on obstetrics and gynecology, have really called for the administration of this vaccine to pregnant women. They've asked for women to discuss the risks and benefits with their doctor or their healthcare provider before they receive it. But the national organizations are very much in favor of the vaccination for their pregnant patients.
Do I have to get both injections of the vaccine? We talked about this earlier, and the answer is yes. The first dose really is just to prime the immune system to get the second dose and to get the really robust immune response that's going to be long acting. So everyone getting the first dose will have a second dose available. We should not have a problem with that. And for the Pfizer vaccine, it's given 21 days later, and the Moderna is 28. Doesn't have to be exact, but kind of in that day range. You don't want to wait too long, and you don't want to go too early. So is the vaccination safe for people on immunosuppressive medications? The answer is yes, and we would encourage people who are immunosuppressed to get the vaccine. Both trials enrolled patients with immunosuppressed who were immunosuppressed, and it did give them protection. It is more dangerous to acquire COVID-19 infection if you are immunosuppressed. This last slide is the Idaho Department of Health and Welfare, and this is a new piece of information talking a little bit about when can I receive my COVID-19 vaccine in Idaho. And the reason we've included this is, number one, to show that there is a tiered, staged approach. Number two, to show the approximate dates across the bottom. And then number three, to really outline and highlight that there's been a lot of deliberate and very careful thought that's gone into making sure that we vaccinate certain groups early on in the process and potentially certain groups later. Obviously, we focused a lot of attention in the beginning on people working in the hospital, not just the doctors, but the nursing staff, the laboratory staff, everyone in the hospital that was at risk for acquiring COVID-19 was early on in that vaccination process. As you move across the slide, you start to see additional individuals included in the vaccination rollout that are people that tend to be exposed to the public more often. It might be someone who works at a grocery store or a convenience store. You start to see teachers and daycare workers included. And then moving further to the right again, we start to talk about people who are at higher risk for severe infections, and that might be patients who are over the age of 65 or people under the age of 65 with severe
or advanced other health conditions. And the hope would be that as we move from left towards right, we start to see greater numbers of vaccinations, not only in the hospital setting, but also in the community. And as a result, and exactly as Dr. Scoggins has said, the way that we basically overcome COVID-19 is through vaccination. And our goal and hope is that we've been able to provide some information and some facts to those of you that are watching so that you can help make your own decision. We always welcome you to discuss this with your healthcare provider. The two of us have over 40 years of critical care and pulmonary care experience, and we hope that that experience is translated into information that you find helpful moving forward.
I'd also say on this is I wouldn't get focused on the dates at the bottom. I think that we're beginning to move through this quicker than that, and we're going to move as fast as we can to vaccinate as many people as we can. So I think that we will hopefully be moving faster than this and getting people in our community. The way to get back to normal for us, we'd like to see our number of patients in the ICU with COVID go down. We had over 20 today in our ICU who are severely ill and at risk of dying, and it's too many. It's too many. Too much resources. It's too much people who are suffering, and the way that we get rid of those people out of the hospital is for people to vaccinate and to stop the spread of this virus in our community.
Thank you very much.